Congratulations! You've made it to the second half of your pregnancy. I'm Dr. Carolina from Sono Health. In the first half, your baby was growing fast and was just beginning to look human. From now on, your baby will be gaining weight and coming into proportion. Thank God morning sickness is not an issue anymore. But now you'll experience new discomforts regarding weight gain. You'll probably feel like your baby's using your belly as a gymnasium, which could be very annoying. By now, your baby bump has added an extra 15 pounds and you're gaining more every week. You're probably feeling hungrier than usual. Your baby's now about 10 inches long and weighs about 12 ounces. His eyelids are now fully formed and his taste buds are also developed. That means your baby can taste the flavors of what you're eating. By week 22, you should be able to feel your baby move more often since he's almost 1 pound now. At this time, you could start having swollen feet or ankle. The best thing to do for this is keep your feet elevated and try to avoid high heels. During week 23, you could experience some vaginal discharge because there's an extra amount of blood flow. This week, your baby reaches about 12 inches long and weighs about 17 ounces. Did you know that skin is developed before fat? By this week, your baby's skin is still loose, but it's starting to develop skin color. At this stage, you may experience something called Braxton Hicks contraction. It's your uterus's way to get ready for birth. They're sporadic and painless contractions. Another difference with the real ones is that they're not regular. Your baby weighs now about 21 ounces. If your baby were born prematurely at this stage, there's a chance he would survive. However, he might still have trouble breathing because his lungs are not fully developed. During this time, your doctor may perform a glucose screening test to check for diabetes. In some cases, pregnant women don't produce enough insulin to regulate their sugar levels, and this can bring a whole set of problems for the baby. Now, at this stage, your baby's the size of a turnip. He's slowly starting to gain fat, so now when you look at him through the ultrasound, he'll look more and more human. Don't forget to take good care of your skin. At this point, it may be dry and itchy, especially around your belly and around your breasts. I recommend a combination of coconut oil and shea butter. Your baby weighs now about 2 pounds and he's almost 14 inches long, and you've probably gained at least 20 pounds. Up until now, your baby's eyelids had been closed, and now your baby can open his eyes and sometimes even blink. By week 27, your baby's almost 15 inches long. Your baby's movements are more powerful now, and you can even start to feel soft, rhythmic spasms. Believe it or not, they're your baby's hiccups. Since his lungs are still developing, so is his diaphragm. This is a very thin muscle that divides the lungs from the abdominal cavity. That's why hiccups are common during this stage. At this point, he's already established a wake and sleeping schedule. Some people can advise you to rest when the baby's resting to sync your schedules, but I wouldn't worry about that now. Once the baby's born, you two will have to learn a totally new agenda that will involve feeding, bathing, and sleeping hours. So, week 28, congratulations, you've made it into the third trimester. Around this time, you can experience constipation because the uterus puts pressure on your colon. Your baby weighs about 2.5 pounds by now, and by now, your baby's heart should be beating very quickly. It's a great time to use a fetal heart monitor. It should be a lot more easier to hear now. By this time, you could be experiencing some venous insufficiency. As your baby grows, the increasing weight pushes down and places pressure on the veins in your upper legs and lower abdomen. The pressure forces the blood to stay in the leg veins rather than flowing upward. The best way to relieve this is to keep your legs elevated as much as you can. And if it's winter, you could try using compression socks. Now, why do I recommend them in winter? It's because in summer, the high temperatures can make them pretty difficult to tolerate. Your baby's about 15 inches long and he may weigh close to 2 pounds now. At this point, you might be suffering from back pain, especially your lower back. So it's important to practice a good posture, and if you're up for it, you can check out some very easy exercises to relieve them. For example, there's the happy to angry cat stretch. Start on all fours on the floor, arch your back as highly as possible with your arms directly under your shoulders and head facing towards the ground. Hold that position for 20 seconds and then relax. Again, from the relaxed position, reverse the move by tilting your head towards the ceiling and hold. It's important to allow yourself to take it easy. Your baby's about 3 pounds now and he will continue to gain weight. At this stage, babies are practicing breathing and getting ready to breathe outside the womb. As these final weeks go by, you might be feeling more and more uncomfortable. You might have trouble sleeping, your breasts can start to lactate. This means they're starting to leak a yellow liquid. It's perfectly normal, it's called colostrum. And this is the first milk your breasts make in preparation for feeding your baby. If your baby's kicking was becoming painful, you'll be relieved. By this week, you'll notice less movements because he's becoming big and there's less room to move inside the womb. Your baby's brain is still developing and his bones are still soft. His head may have moved closer to your pelvis, so you might even feel some pressure on your pelvic area and your lower back. It's normal to gain about 1 pound per week at this point. Remember that you can expect insomnia and waking up 3 to 5 times a night, usually because of back pain, needing to urinate, leg cramps, heartburn, and baby kicks. In this stage, your baby is growing layers of fat and his bones are becoming stronger, although the skull will remain flexible until birth. In the 34th week, you'll probably start to feel swelling, especially in your hands, legs, and feet. Keep in mind that sudden swelling, especially in your face and around your eyes, can indicate preeclampsia, so always check your blood pressure if this happens. At this point, your baby's lungs are still developing, but the rest of his organs are matured. Your baby now has the facial features that will make him unique. He's around 5 pounds and 18 inches long. Delivery is only a few weeks away and you should be starting to preparate for it. I recommend to begin with Kegel exercises to strengthen your pelvic muscles and make it easier for the delivery moment. Most of the development is done by this time. However, if your baby is born during this week or any week before the 40th, it's very likely that he'll survive and be healthy. But you'll probably have to spend a few days in the hospital with you to monitor his vital signs and make sure that his lungs are fully developed. You're very close to delivery at 36 weeks, and it's probably that your doctor will be scheduling weekly visits at this point to ensure that everything's okay. The bad news is that the symptoms you've been experiencing for the past few weeks are still there. We're closing in on 6 pounds by now. You're getting close. You've reached your last pregnancy stages. Most women give birth between week 37 and 40, so you could be meeting your little one anytime now. If you haven't yet, you'll be experiencing an increased pressure on your pelvic bones, and as your due date approaches, your baby's growth will actually slow down. I know I've mentioned this before, not only in this video, but in others as well. Stress during pregnancy is something you should always try to avoid. I know it's not always easy, but if there are situations that you know will stress you, try to avoid them. Why is this so important? You're getting close to your delivery, and stressful situations can release a huge amount of cortisol in your bloodstream. Now, this can not only trigger your delivery in a very traumatic way, but also studies show that a large amount of cortisol, especially around birth, can have many psychological effects on the baby. There's new research that show that some psychological effects, which cannot be explained by any other means, can be traced back to this point in his life. And these effects can also continue into their adult life. It can be an impact on the connection with your baby, especially in the first few weeks after birth. These initial weeks are crucial for building a strong bond between you and your baby. And finally, but not less importantly, studies have found that women that have a stressful delivery have more chances of experiencing postpartum depression. By week 39, you're likely experiencing a lot of discomfort, like vague labor contractions, difficulty sleeping, sore breasts, pelvic pressure, and back pain. If your baby's born this week, his organs will be perfectly able to function. He could weigh up to 7 pounds at this point. Congratulations! You finally made it to your last week of pregnancy. If you've reached this point, it's been a long road. Most women who are giving birth for the first time almost never get it to their 40th week. Since the baby's size is fully grown by now, he's too large to move, so you may feel lesser movements. Even though all his organs are functioning, I recommend you to start counting kicks. You can check my video on this. And the reason I recommend this is because stillbirth at this point is still a risk. Remember that you should feel at least 10 movements in 2 hours. I also recommend to use a heart fetal monitor. Hearing your baby's heart can be reassuring, and it can help you recognize if your baby's in distress. If your bundle of joy hasn't come into the world by the 40th week, don't worry. He may be taking his time. This can happen sometimes. It's important to have regular doctor visits to ensure you and your baby are healthy. And here's an extra tip. Many moms ask me the same question. How will I know when the real contractions begin? How can I be sure it's not a false alarm so I don't go to the hospital unnecessarily? Well, unlike Braxton Hicks contractions, these are going to feel different. Remember that Braxton Hicks contractions are irregular, unpredictable, and never get intensely painful. They come and go at random intervals and ease up when you change positions or take a walk. On the other hand, real labor contractions will come at more regular intervals and maybe closer to 60 seconds each. Trust me, you'll know. So I hope you enjoyed this video, and most of all, I hope you found this information useful. You can share this with other pregnant women so they know what to expect. So tell me, how many weeks far along are you? Do you have any questions? I'll be more than happy to answer them. Just leave them in the comments below. I'm Dr. Carolina Melgar from Sono Health. Thank you for watching.